Good morning, everyone. We're so excited that you have joined us today to watch this interview. We're excited. We have the privilege of meeting with our Senior Director of Health Services at the Village at Gainesville, Kim Giberti. So our goal today in this short video is to learn more about Kim, to learn about her team of exceptional nurses, and also a little bit about the departments that they work in. So I'd like to get started just by wishing Kim and all of our fabulous nurses a happy Nurses Day. Today is Wednesday, May the 6th, and this kicks off annual National Nurses Week. And so we want to say thank you to all of our nurses at the Village at Gainesville, as well as all of those out in our community and throughout the country. We appreciate our nurses every day, but especially with what we're all dealing with related to the coronavirus and the pandemic. So thank you. We hope you all feel very appreciated, and we just want to recognize you for all that you do today and every day. So we're going to just get started. I'm going to ask Kim some questions and get to know her to start with. So good morning, Kim.
Good morning. Thanks for having me here today.
Yeah, we're excited for this. So tell me a little bit about what drew you to nursing as a profession.
Right. Wow. I kind of really have to think back. I think my heart for just working with people and caring for people started at a very young age. I was actually a candy striper at a hospital at the age of 12. And it really brought joy to me to be able to deliver flowers and cards and often sit with people and learn really about, their stories and then, maybe even brighten their day. So at a very young age, I realized, oh, wow, this is what I want to do. I think I want to do this. So then I just explored nursing as a profession and, recognized again early on that nursing is just a limitless profession. So there are so many opportunities within nursing. There are so many different, the profession offers a wide variety of opportunities, anything from surgery in the hospital setting, clinics, you could go into education, management, and nurses, let's face it, are really respected as a profession. And I wanted to be a part of that. So really, I would think my caring nature and just, the endless opportunities really attracted me to nursing at an early age.
Wonderful. So how long have you been a nurse?
So a long time. I went to the University of Florida right after I graduated from high school. It took me a little bit to figure out what I wanted to do at UF. I did anything I looked at though was in the healthcare profession. So I knew at that time that I wanted to pursue something in healthcare. I was accepted to the College of Nursing, and I'm a Gator nurse. Woo woo, go Gators! Yep, doing a chomp there. And so I've been a nurse for almost 30 years, 27 going on 28 years. And it has been just the most remarkable experience. And I often tell people that it is one of the best decisions that I've ever made in my life, and I wouldn't regret it for a minute. So when young people ask me, do you like being a nurse? And I can talk for hours about that. What drew me to nursing and why nursing is just the best.
Yeah. Okay, that's fantastic. Well, we're very fortunate to have you at the Village at Gainesville. And so let those that are watching know a little bit about your role then. What exactly is it that you do at the Village at Gainesville?
Well, most of my career in nursing, I did start out in the hospital setting, and I did some CICU and some telemetry step down. I did some emergency room and then also, clinic settings. But most of it's been in healthcare and nursing management. I was a charge nurse early on, and so that kind of formed me as a leader within the field. I've worked at the Village for 8 years. And
Wow.
I began yeah, it's pretty cool.
That's great.
I'm very excited. And I hope to work here many more as well. It's been, like I said, a very rewarding experience. And I feel blessed to have the opportunity to work here at the Village with these amazing residents. So I started out as the Village Jasmine Point Assisted Living Manager. That started my Village journey. I did that for a little over 4 years, and then I was promoted to the Senior Director of Health Services, which is my current role. So in my current role, I have the overall responsibility of overseeing the Village Vitality Program, the Village Private Duty Home Care, and also the Village Assisted Living and Memory Support neighborhoods. So I oversee and work in administration, and I have a great group of supportive leaders in those roles. So they stay busy and they help me make sure that we are providing, good quality of care and really enriching the lives of the seniors that we care for here at the Village.
Well, that's a perfect segue because I would like for you to share a little bit about some of those nurses that are in leadership roles, learn a little bit about them, and then maybe touch on, you mentioned a couple of different departments, and some of our viewers, may not even be aware that we have those different departments within the Village at Gainesville. So that would be great to learn a little more.
Great. My pleasure. Like I said, I have an amazing team of nursing professionals that really are committed to enriching the lives of our seniors. Believe it or not, I added up the number of years that just my leadership team has, and it's over 100 years of nursing experience that we have as a team. Just various nursing settings. So what's really neat about our team here at the Village is that we all bring our experiences within the various specialties of nursing, and we bring those specialties to the community. So for instance, I'm a cardiac person. So I'm the person that people usually go to about hearts, and Teresa's a diabetic educator. And so she's asked all the diabetes questions. And, Vicki and Michael, they have clinic settings. Jan is the home care person and has done she's had years of experience in home care. So, but just to start out, to recognize each one individually and just a little bit about what they do for the Village. Teresa is a registered nurse, and she's our vitality nurse supervisor. So really, Teresa oversees our vitality program. She works with our vitality team, and that her job is to really ensure that our independent living residents maintain their health, their well-being. She keeps them happy and healthy along with her team. And she would say, Teresa, this is her saying, she would say that she helps our residents navigate the healthcare continuum, so that's what Teresa always says. And so we are so fortunate to have Teresa as part of our leadership team. She really adds value to the team and brings a lot to the table. And then we have Vicki. Vicki is a LPN, and she is our Director of Assisted Living and Memory Support, and she oversees all assisted living and memory support neighborhoods. She provides leadership and oversight of all clinical operations, and she's more strategic in nature and planning. So Vicki brings, again, years of experience. And then working with Vicki in assisted living is Michael Jackson, and Michael Jackson is also an LPN. And Michael is our assisted living and memory support manager. So Michael's responsibilities include overseeing the assisted living and memory support day-to-day operations. He works really closely with the CNAs and our supervisors to ensure that we're enriching the lives of our seniors, and that we are providing that quality of care. So his job is super important, just like the other nurse managers. Then we have Jan Eckler. Jan is a registered nurse that comes to us with lots of home care, Medicare certified home care experience. And so she is our manager of Village Home Care, our home care administrator. So Jan oversees, she's the only RN or the only nurse in that department. So she's pretty busy. She oversees all of the Village Home Care operations. And she provides leadership and oversight to the CNAs and the home health aides and the office staff that work in our home care department. So that pretty much summarizes our leadership team. We do have a very healthy group of nurses that are considered our nurse supervisors.
So tell me a little bit about then, how many nurses overall does the village employ, and what would you like to share about this special group of individuals that you have the privilege of leading and working with every day?
I really do, Deborah. I'm really privileged working with these individuals. Again, their experiences are just so varied, and if we had enough time in the day, I'd sit here and I'd love to recognize every one of them because they are so very special. But we actually have 29 nurses, which I think is a pretty incredible. Yeah, I think it's pretty incredible. We employ 29 nurses, a combination of RNs and LPNs. And so we have 16 RNs, 3 LPNs. And our nurse supervisors are extremely important. They play a huge role in our nurse leadership team. A majority of our nurses, 23 to be exact, of the 29 work in assisted living and memory support. And our AL and memory support nurses work very closely with our dedicated CNAs to deliver optimal patient-centered care. So they're the boots on the ground. Our nurse supervisors are out there. They're on our front lines. And, they all have a strong knowledge about assisted living, memory support, rules and regulations, and how to work with those, residents. They have strong communication skills, as well as really, most importantly, a genuine trust and respect for our most vulnerable population. I really consider these nurses in ALs the heart and soul of our assisted living and memory support team. We really couldn't do it without them. And so I respect each one of them and the job that they do and the teams that they lead, because they are why we are so successful here at the Village, and we deliver the type of care that we deliver. So our Vitality program, our Vitality program nurses lead the charge on encouraging our independent residents to embrace their vitality and wellness. And so this group of dynamic nurses, call them the dynamic duo, and then we have a PRN nurse that kind of fits in there as well. But they provide support across the healthcare continuum. They work with the residents I had mentioned earlier, and their families to help support and promote their overall health and well-being. They perform wellness assessments. They are doing hospital and rehab checks, and they're really, they are the heart and soul of our independent resident Vitality program. So they do an amazing job, and our residents really look forward to those visits and rely a lot on those Vitality nurses. So really, I think being a Village nurse, whether you're in nursing leadership or whether you are in Vitality or home care, no matter what your role, I think it's just an incredibly rewarding and humbling experience to care for the residents here at the Village. It's an experience like no other.
Thank you, Kim, for sharing so much information. I learned something today, which, I hope our viewers learned as well. I think it's fantastic. I did not know we had 29 nurses. I think, I know our health services team is one of our the things that really is a highlight of our community at the Village at Gainesville. But what a robust and amazing group we have. So I appreciate learning more about them and more about you, and just thank you for taking the time to share that information today, and helping to, to get to know you better and get to know our team and our departments just a little bit better, and to help us celebrate really the clinical leadership and the clinical team that works with our residents every day. It's just wonderful to know more about them and have an opportunity. So on behalf of everybody watching, I'd like to thank you and all of the Village nurses for all that you do every day. We recognize and we applaud your dedication to serving others and serving our residents. So we wish you a happy Nurses Day and Nurses Week, and look forward to seeing you all in person shortly and in the future. So thanks so much for joining us, Kim.
Thank you. Thanks a lot. My pleasure. Have a great day.
And thanks everybody for joining us on this video as well.